Welcome to the Nurses Beyond Borders, the podcast series where we shine a light on the incredible journey of internationally educated nursing academics shaping the future of nursing in the United Kingdom. I'm your host Joshi, and I'm thrilled to have you with us. Like birds that soar in skies so wide, they leave their homes, their hopes held high. Across oceans and borders, thousands of internationally educated nurses embark on a journey to the UK, bringing with them not just their skills, but their passion, resilience, and dreams of making a difference. As we celebrate International Nurses Day, we recognize their contributions, challenges, and the strengths they bring to healthcare. Today, I'm thrilled to welcome an incredible guest, Nicole, a highly experienced and dedicated nursing professional whose career spans multiple countries and decades of impact in healthcare and education. Nick began her nursing journey in 1989 from Bavaria in Germany, before relocating to the UK in 1997. With a strong foundation in acute medical and cardiology nursing, Nick is bilingual and holds qualifications to practice both in the UK and Germany, as well as being registered with the State Board of New Mexico after successfully completing the USA's NCLEX examinations. Since 2018, Nick has been shaping the future of nursing through her higher education, bringing expertise from an MA in education and recognized teaching qualifications. At the University of Salford, Nick played a vital role in launching the Nursing Associate program, contributing to the growth and ensuring its impact on the profession. Outside of nursing, Nick is a passionate hiker too, often found scaling the peaks of the Scottish Mountains or the Lake District. Her philosophy is, quote unquote, to aim for the highest point is not the only way to climb a mountain. Nick says this reflects her approach to education, mentorship, and personal growth. Nick, it's an absolute pleasure to have you on this podcast today. Welcome, Nick.
Thank you for having me. I really appreciate it, Joshi.
Thanks, Nick. So yours is an incredible journey, from a small town in Germany to where you are now. So how did it all begin, Nick? What inspired you to choose nursing as your profession?
So at the tender age of 15, I had to decide or think about what career path I was going to take. And there are no nurses in my family. There are quite a few teachers, but there are no nurses, no doctors, no healthcare professionals in the family. And I wanted to look after people, and I also wanted to travel. So that was one of the reasons I went into nursing, because although I was only 15, I was thinking about what job could give me a life abroad, what job would always give me an income. Because even at the time I knew there will always be sick people, ill people, people who will need my help. So nursing was the only profession at the time I could think about. So that is why I went into nursing, to be there for people, look after people, and to travel. Yeah, but originally I wanted to go to South America or South Africa.
Okay.
Rather than England.
Wow. So what made you come here then? Why did you choose England then?
So I found love on holiday.
Okay.
And that is how I ended up here.
Okay.
So I qualified, worked in Germany for a couple of years, and then I fell in love with an Englishman, and that is the only reason I came to England.
Wow. Okay. Love changed it all. That's great. So,
and it didn't work out, but I stayed.
Oh, that's good. Nursing made you stay. That's great. Wonderful. So, Nick, it's a big transition, isn't it, from Germany, from the type of education you had there, from the type of work experience you had here, and what were the major differences? How was your first day in the NHS?
So the first day, culturally, although obviously Germany and the UK, England, they're both European countries, I guess I wasn't prepared for, because I didn't know anything about England really. And I wasn't prepared for the cultural differences. So even little things like in Germany, and I think it's probably still the same today, you do not address a patient by their first name, for example.
Yeah.
It is Mr. and Mrs. And, that's how you address your patients. And then I came to England, and there was Ethel in bed 1, and there was John in, whatever, room number 2 or 3. So even things like that I found very challenging. The routine in terms of what people eat, what patients eat, the times are very different, how you address a patient, to nursing care as well. Nursing care was very different. So in Germany, when I trained, nurses did everything. You washed the patient, you fed the patient, and then you carried out more complex procedures as well. We didn't have support workers, so I had to get used to the way of working in the UK and the hierarchy, and actually the who is who.
So there were differences in terms of the way you are trained outside and how it was. Before the podcast, you were sharing to me an incident about the word commode, which you didn't know.
Absolutely.
Do you want to share it with our listeners, please?
So a commode, or commode, so should I say, like in German, is a bedside cabinet. So I remember one of my first days on the ward, a patient asked me, I said, I need the commode. So I knew that the patient didn't meant for me to get a bedside cabinet, but I didn't know what the patient meant. So by then I finished my training. I worked in Germany for 3.5 years. I was a sister by then, so I'd climbed up the ranks quite quickly, and here I was on my first day, or one of the first days, working in England in an NHS hospital, and I didn't understand what a commode was, so I had to ask somebody. And obviously when they brought the commode, I knew what to do with it, but I just felt stupid. That's the reality. I felt like, I should have known that, but I didn't, because there's not the sort of words you learn when you go to nursing school or when you go to primary or secondary school. So I never forgotten that, actually. That was, in fact, that's probably the only thing that really vividly stuck with me for all them years, when I just really didn't know what to do and how to look after the basic needs of a patient, because I just simply didn't understand
the terminology.
What they wanted, the terminology.
I get it, Nick. I had a similar situation as well, where I didn't know what bottle meant for patients. To me, a bottle is a drinking water bottle, and I had a similar situation as well. So you said you were experienced back in Germany for nearly 3 years, and you've climbed up the ladder. So when you moved into the UK, was your experiences before considered, or did you have to start it from the scratch?
So I had to start again. So back in Germany, so I'd finished my training, because I started when I was 16, so I was really young. There was a nursing shortage over there. So they actually gave me permission to start at 16 rather than 17. Finished my training, then worked as the equivalent as a staff nurse or grade 5 nurse, and then became a sister, and eventually in the last sort of 6 months I was a sister in the private wing of the hospital, where a new professor set up a new neurosurgical service. So I did that in the space of a very short period of time, and then obviously I came to the UK and I had to start again. So my previous experience possibly got me the job, which obviously but again, by the time I came here, there was a nursing shortage in the UK as well, so it was quite easy, I think, to get a job at the time. But I had to start again as a band 5, as a junior nurse, or at the time it was a D grade, and I stayed a D grade, or then it became the banding, a band 5, for a good 10-15 years.
Oh my goodness,
So quite some time until I became a sister.
Was it? Why didn't you try to? Were there any challenges for you to climbing up the ladder, or was it your choice?
Partially, for the first few years, it was that there was no need. I wanted to get embedded into the role and understand it better. Then I had a baby as well, so that was okay for that time. And the ward I worked on, there was really beautiful camaraderie. It was managed really well, and there was no need. I didn't feel I needed to become a sister in order to flourish in my career. I was allowed to have some secondments, so I dabbled in tissue viability. I was allowed to explore my passions, which was still wound care really. So I was allowed to develop myself, my skills, my knowledge, my behaviours as a band 5. Obviously, money-wise, I didn't earn any more. But then at the times when I did apply for a job, I didn't get it. It would go to somebody from the UK. And obviously make out of that what you want.
Yes,
but I didn't get that.
I get that. So that must be a hard journey. So what were the barriers and the opportunities you had in this journey of working in healthcare? The major barriers, sometimes we ignore the fact that coming from an European country just doesn't give you the entry to something, to a higher ladder directly. You have your own struggles, which many times it's not addressed, because you might look, like an English, but then you're not considered as an English. Sometimes it's a fact which I've heard from many of my colleagues who worked with me before as well. So what would you say as the challenges and the opportunities for you?
So in terms of opportunities, so I need to kind of go back to actually why I came to the UK, why I came to England in the first place. So that to me was the opportunity, because that's the opportunity that I wanted.
Yeah.
So it gave me the life that I wanted, and that was to move away and to live abroad. And in terms of the role of the nurse, the role of the nurse is very different to Germany and the nurses here. And I know things have changed in Germany, but I was allowed to carry out more complex procedures, even venipuncture, for example, cannulation, IV medication. It was very much doctors-led back home. So in terms of opportunities, I could learn many more skills than at the time I could have done in Germany. I learned to make my autonomous decision, and I was more respected than at the time it was in Germany, because it was very much the doctor said, the nurse did. Now, that was a beautiful opportunity in England, that I was allowed to work more autonomously, but it was also a challenge, because I had to kind of understand actually my positionality, where I sit within the team, and I take on all these roles. But so from an international point of view, I never saw myself as an international nurse. I just, even to this day, I see myself as a nurse. I never class myself an international nurse, and potentially before Brexit, most European trained nurses possibly would not consider themselves as international nurses. You were but you were from Europe. You were a nurse from Europe, and you were okay and allowed to work anywhere within the European community. So I was always just referred to as a nurse. So now I think this has given me, there were so many opportunities all the way through, but actually now, right here, right now, the fact that I'm an international nurse is a big opportunity to educate globally about the value and all the good things we can actually contribute to UK healthcare.
Exactly, a nurse is a nurse is a nurse. Yeah. Anytime, isn't it? So that is a tough but a resilient journey of yours. So what made you move into academia then, Nick, after a tremendous experience from healthcare? So
it goes right back to when I did my training, because when I did my nurse training, so just obviously I mentioned before, at the age of 15, I knew that I wanted to go into nursing, but one of the things that to this day I can still hear is, so back then opportunities for women were very different than the opportunities women have these days in Germany, in the UK. I know this is globally very different, but I remember one of my aunties saying to me, well, you just want to become a nurse because you can't get a proper job anywhere else. So that kind of, sort of stuck with me. And I wasn't particularly good at school. I didn't like going to school because I was forced to learn things I didn't want to learn, really. And in terms of my family background, it was like, well, I just wanted to be a nurse, and because I'm just not good enough for things. And then, I finished my high school and I started my nursing training, and all of a sudden it was like it was so empowering. It was a revelation. It was so different. And I've gone from not wanting to go to school to wanting to go to school. I wanted to learn everything that there was. And I've had some absolutely amazing educators. And I remember, I can still see her. It was in my first year. And I was just in awe with the educator that led our cohort. And it was there and then when I knew that at some point in my career I wanted to go into education, it was because of the impact she had on me, the impact she had on others, and how she was and how she empowered me, and the role model that she was. I knew that one day I wanted to give something similar to other people, and that's what it is. It's taken a long time, So I've been in academia for 7 years now, 8 years. So yeah, my journey was very different, but it was always there in the back of my mind. And working on the wards, I've always looked after the students. That was always my biggest passion, to help people and help students, help individuals along the way to reach their goals, their dreams. For whatever reason, they've gone into nursing, and everybody goes into nursing for very different reasons. And I just wanted to help them reach their goals because I had somebody help me reach my goal.
Wow, that's why. So when you inspire someone, it's kind of contagious, isn't it? It's contagious and it spreads. That's fabulous. So with your vast experience, what do you bring into the education system here, and what role do you play in decolonization of nursing education?
So I think in terms of what I can bring is my experience as a human, my personal experience, whether that was my schooling experience, whether that was my educational experience, my nursing career, the challenges, the opportunities, everything I've overcome. I can bring all that back to my students, and I'm in my 50s now, so I've got a lot to draw from, really. So I can bring myself in. I think that's really important, and I can bring my outlook and my open mind into the here and now. And in terms of decolonization, until recently, for me, it was being able to actually see decolonization to me is a relatively new terminology, and I hadn't really thought about that until we started talking about that. And so that made me actually look into the UK, what decolonization actually was, more into like the UK history and the global impact. That then made me examine actually where we stand from a European aspect and from a German aspect as well. So I had to understand that. And initially I thought all I can get or give is my open-mindedness to make things better and different, be open to being challenged, break down stigma, break down barriers, open doors, push the narrative. Now that we're talking about, actually, like I said, I never saw myself as an international nurse, but I am an international nurse, so I can actually bring that into as well, my passion and my pride to be an international nurse, and bring that to decolonization as well, and shift the narrative, because quite often I don't know if you agree, but when we talk about or think about international nurses in the UK context, would you think of a European nurse? Would you think of a white female nurse from Germany? Potentially.
No, not many times.
Not many.
It's not,
But it's actually, so what I can do is actually open the discussion around decolonization beyond what maybe at the moment is being viewed as the need.
Yes, the inclusivity we bring in for all of us. Yes, that's very well said, Meg. Thank you so much. So what would be your advice for future nurses or to your younger self?
To my younger self is do exactly the same again. Have your passion, pursue your dreams, and that is, I think, the advice I would give to anybody. Always remember why you've gone into nursing. In fact, that's what I say to my students now. When the going gets tough, because it's not an easy career, education isn't easy, just remember what brought you into nursing in the first place. And remember that. You wanted that change. You went into nursing for a reason. Remember that, cherish it, and work towards it.
That's insightful, Nick. So I've got a set of rapid-fire questions now.
Ooh.
All right. Are you ready?
Go on then.
Okay. So coffee or tea before a lecture session?
Oh, it has to be coffee.
Thank you. Are you an early bird or a night owl?
An early bird.
Fantastic. If you could teach anywhere in the world, where would it be?
Somewhere on the beach, somewhere where it's nice and warm.
Okay. Okay, anywhere in the world where you got a beach.
Anywhere in the world, yeah.
And you want to teach?
Anywhere.
What subject would you like to teach there?
Do you know what?
Yeah.
I think I would still stick with nursing, maybe because that's all I've ever known.
Yes, okay. Is there anything in particular from nursing you will want to teach there, aside of a beach?
Professionalism,
Wow.
communication, and breaking down barriers. I think is challenging the narrative. I think
Yeah.
empowerment. I think that's
You
what
can
I want
use
to
the
teach.
environment, isn't it? You can use the
Empowerment.
seawater, the waves, and the the beach sand. Yeah, that's great. So, what's your go-to stress reliever after a long day?
Oh, after a long day, I might just have a hot bath, but then come Friday night, I'm out in the mountains.
I was expecting the mountains. Yeah.
I can't go up the mountains every night, but yeah. So a hot bath during the week, and then Friday, Saturday, Sunday, let's go into the mountains.
Yeah, if I need to find you, I can find you.
Anywhere.
I know a Scottish mountain. That's great. So, if you weren't a nurse or an academic, what would you be doing?
Well, I've often asked myself the question, and I genuinely don't know. I think I would travel. I would just become a hiker. I would travel, but I don't know, and that's why I've never changed career other than going from nursing into academia. But
Yeah.
you still look after people in academia, so it still goes back to looking after people.
Yeah.
I don't know. I really don't know.
So, one thing you love about teaching nursing, and one thing you would want to change.
What I love about nursing is I love seeing students succeed and achieve their dreams, and that doesn't mean reaching the highest marks. It goes back to my
Great.
motto, there's different ways of reaching the summit, or different ways of climbing a mountain. So I absolutely adore and love to see students who've made it through the ups and the downs.
That's great. And one thing you would want to change?
What I would want to change is I would want educators to have a more open mind, and not be stuck in their ways, listening to the student voice, listening and accepting that younger people have a different outlook, different needs, different priorities, and actually respect that and work with the younger generations, rather than us imposing our. And I've got 35 years experience. Things have changed a lot, and I think it is not right and not fair to enforce my outdated views, or potentially outdated views, on the younger generation. And so that's why I say have an open mind, a broad mind.
Yeah, that's very well said, Nick. We have to come out of the knowledge bias we have. Maybe we might know something, but we can't expect the same for our student when we start before teaching a session. And we need to upgrade ourselves as well, isn't it?
It has to come from us,
Yes,
absolutely.
yeah.
So the change has to come from us, and I think this is when you speak with colleagues, or when you read some of social media, for example, we want, or the expectation of some educators is that the students have to change for us, and actually, no, we have to change for our students. And I think I'm all right. And that's, I've done that, so I have no problems. And, in terms of how I perceive the younger generation of students, but I do see some of my colleagues struggling with that, and I think I think it's a fact. They need to change their mindset.
Yeah.
We need to change.
It's reciprocal process as well, isn't it? Yeah, it's a mutual process as well. Yeah, that's great. That was a very insightful conversation with you, Nick, really, and thank you so much for
Pleasure.
joining me today. Is there one last thing you would want to say to the listeners before we wind up?
What I would say is, if you have the wish, the desire to work abroad, and I don't know where you're from, where you're listening, but if that is what you want, just go for it. Just absolutely go for it. Follow your dreams.
That's great. That was really an insightful conversation with you, Nick. Thank you so much for joining me today. And so, to those who are listening, this is Joshi, your host.